A very serious outbreak of hantavirus has been unfolding in front of the world over the past few weeks. This saga originated on a cruise ship that sailed from Argentina towards Antarctica and then across the Atlantic Ocean, stopping at remote islands on the way as passengers and crew members fell sick. This is all according to information from the cruise ship operator, the WHO, and ship tracking data. Associated Press is now reporting that nearly a month passed between when an elderly Dutch man fell sick and died in the South Atlantic and laboratory tests in South Africa, more than 2,000 miles away, first confirmed hantavirus infection. 3 passengers have died. 1 is in the intensive care in a South African hospital, and 3 others were evacuated from a ship on Wednesday. Another man who left the ship earlier in the voyage tested positive in Switzerland. More than 140 passengers and crew members were still on board the cruise ship as it departed the West African island nation of Cape Verde for Spain's Canary Islands. The Dutch Health Ministry said Thursday that a flight attendant on the plane, briefly boarded by an infected cruise passenger in South Africa, was showing symptoms of potentially hantavirus and would be tested in an isolation ward at an Amsterdam hospital. The cruise passenger, the Dutch woman whose husband died on the ship, was too ill to take the international flight to Europe and was taken off the plane in Johannesburg, where she died. If the Dutch flight attendant does test positive, she could be the first known person not on the cruise ship to become infected in this outbreak. So, welcome to Transmissible. We've got a hot topic today. This is all over the media. It's all over social media. You turn on the news, this is the topic everyone's discussing. Usually I do kind of an intro and a discussion of just kind of like life and stuff, but today I'm not going to do that. I want to jump right in to the science, to the epidemiological data, and whether I think there should be concern for spread. Like I've seen the next COVID, on headlines and stuff. I want to speak directly to the fears of the Andes virus specifically. We're going to discuss hantavirus as a whole, but some of the communications I'm seeing around this from the media is talking about hantaviruses as a whole, and they're talking a lot about rodents and stuff, but I want to speak directly to the Andes virus. This is a hantavirus, and about human-to-human spread, specifically how it happens, what the epi data says, and if it should be something we should be concerned about. So let's jump in. I want to briefly introduce myself. My name is Jessica Stahl. I have spent most of my career as a contract microbiologist with the Centers for Disease Control and Prevention. CDC is the U.S. government's leading public health institution. First, I worked with dangerous and rare pathogens in the laboratory. Then I traveled internationally to train scientists and doctors in rare bacteria identification. I then worked on the emergency COVID-19 response on the laboratory and testing task force, working on health communications and with the media. I also have my MPH from UAB with a concentration in epidemiology. This is my passion project podcast, and I jump on here. We cover, any public health topic under the sun, but I tend to lean infectious diseases. So hantavirus, this is right in my wheelhouse, and I love talking about communications and how something is being perceived or communicated across different types of media. And this is just exactly what's going on right now. This is absolutely, pun intended, going crazy viral, the topic that is. So let's jump back in. So hantaviruses. Hantaviruses are zoonotic viruses that infect rodents and sometimes are transmitted to humans. Each hantavirus is typically associated with a specific rodent reservoir species, in which the virus causes long-term infection without noticeable illnesses. Although many hantaviruses have been identified worldwide, only a limited number are known to cause human disease. Okay, so that's an important thing. Let's remember that. Hantaviruses present in North, Central, and South America are known to cause hantavirus cardiopulmonary syndrome, HCPS. Now, note here, I am seeing this in communications and the media and even official comms reports described as hantavirus pulmonary syndrome, or HPS. They're kind of taking out the cardio part. This is the same thing. So if you see HPS or hantavirus pulmonary syndrome, hantavirus cardiopulmonary syndrome, these are all the same thing. And this is a rapidly progressive condition that affects the lungs and the heart. Now, the Andes virus is part of this family and is known to cause human-to-human transmission among close and prolonged contacts, primarily in Argentina and Chile. This is our current cruise ship culprit. This is what we are talking about when they are getting on the news and they are talking about hantavirus, X, Y, and Z. We are right now specifically talking about the Andes virus. It is a type of hantavirus. And it is characterized by a brief prodromal illness followed by rapidly progressive non-cardiogenic pulmonary edema. HCPS caused by these hantaviruses from the Americas have a case fatality rate of up to 50%. That's 1 in 2 people who get sick could end up dying. Hantaviruses found in Europe and Asia have been known to cause hemorrhagic fever with renal syndrome. This is HFRS. This is not what we're talking about right now in terms of the cruise ship. This primarily affects the kidneys and blood vessels, and this usually has a case fatality rate of anywhere from less than 1% to 15%. So much better outcomes than the virus that comes from the Americas, which is the one we're talking about. With the cruise ship, this is the one that is capable of spreading human to human. Worldwide, it is estimated that 10,000 to over 100,000 infections occur each year, with the largest burden in Asia and Europe. In East Asia, particularly China or the Republic of Korea, HFRS, that's the kidney one, continues to account for many thousands of cases annually. Transmission of hantaviruses to humans usually occurs from contact with contaminated urine, droppings, or saliva of the infected rodents themselves. Infection may also occur, although less commonly, through rodent bites. Activities that involve contact with rodents, such as cleaning enclosed or poor ventilated spaces, farming, forestry work, or sleeping in rodent-infested dwellings, increase exposure risk. I heard when we moved to Colorado, just kind of like, a lot of people camp here. Colorado is known for like hiking and camping and stuff like that, that if you buy a really old tent off of like Facebook Marketplace or something, that you have to be careful because there could be rat droppings in it and there's a hantavirus risk. That's just something that, is talked about here in Colorado. However, frustratingly, a lot of the news articles and social media posts that are talking about hantavirus are referencing this type of transmission. I was just watching the news before I jumped on here, and the expert that they had on there was talking about this type of transmission, the rodent to human transmission, which is interesting. And they are correct. It is the most common type of transmission with the hantaviruses. However, that is not what the world is concerned about right now. People care right now about the human to human transmission, specifically coming from this cruise ship. And what I have found, and one of the reasons, I would be doing this episode anyways, but one of the reasons I'm doing this episode is because I feel like the fear is very obvious. It's human to human spread. It is, we're coming off of the COVID era where the general public knows about human to human spread and they know it very well. And so their fear is that is going to happen with hantavirus, the Andes virus. But I am starting to hear called the Andes virus more, but I feel like people are still just kind of referring to this as like hantavirus in general. And some of the resources online that I'm seeing in articles are still really just talking about the rodent to human transmission, which great, but I would like to put this out as a resource. We're going to deep dive into human to human transmission of the Andes virus. When the shedding occurs, who is at risk? So that's what we are going to be focusing on for the rest of this podcast. I should have said this at the beginning, but I do want to note that if you are listening to this episode in the future, weeks in the future, months in the future, it could even be next year, this isn't a podcast centered around the cruise ship live breaking news updates. So it's not going to like time out. Like if this were a breaking news episode, you might say, oh, this is from a couple weeks ago. We have new news since then, but this episode is really focusing on the science around hantavirus. So you will be educated on the Andes virus, specifically the epidata, how this virus moves, right? And that is more timeless than breaking news from this cruise ship. So I just wanted to get that out there really quick. Okay, so let's talk about human to human transmission. So to date, human to human transmission has been documented only from the Andes virus, which is, one of the hantaviruses, in the Americas, so North, Central, South America, and remains very uncommon. When it occurs, so when this does happen, transmission between people has been associated with close and prolonged contact, particularly among household members or intimate partners, and it's most likely during that early phase of the illness, the prodromal phase, as you might hear it called. When the virus is, and this is when they think the virus is more transmissible, title. I am linking a few research papers on this. There have been smaller outbreaks in the past, so that's another big fact. This is not the first, little outbreak of the Andes virus. There have been other ones in the past, bigger ones in the past, and they have not gone worldwide. And so I'm linking some papers about those. For example, when they studied how this virus spread in Chile during one of these little outbreaks, the risk of getting sick from the Andes virus was 17.6% among sexual partners of index case patients versus, this is huge, guys, versus 1.2% among household contacts. So that's crazy. So even among sexual partners, which is the, very close contact, the blending, if you will, of sexual and bodily fluids is only 17.6%. And among the household contacts, the people who are living in the house with these people who have illness from the Andes virus, the risk of them getting sick from this virus was only 1.2%. That's crazy. That is right there. That's all I need to know, right? That's it. I can go home right now. That's all I need to know. So why is this significant? This gives this great picture, and this is exactly what epidemiologists do, of how this virus spreads, how it moves, and the characteristics that make it either dangerous to the general public or not. So like we said, sexual partners, they're very close. They're sharing bodily fluids. That's at 17.6%. Sharing a household. So think aerosolization, think fomite risk. All of that combined only had that 1.2% risk. And these findings are just the bread and butter of epidemiology work and what epidemiologists do. The most recent outbreak of person-to-person spread of the Andes virus was from November of 2018 through February of 2019. There were 34 cases and 11 deaths in Argentina. This happened after a single introduction of the virus from a rodent reservoir entered into the human population. Transmission was driven by 3 symptomatic people who attended a crowded social event. I think it said they went to a concert. After 18 cases were confirmed, public health officials enforced isolation of people with confirmed cases and self-quarantine. Sorry, I have to pull up my notes. And self-quarantine of possible contacts. These measures most likely curtailed any further spread. End quote. That's a quote from the paper. This shows that when the spread starts to happen, the public health measures work. They do their job they're supposed to do. Those are the measures that are being implemented right now coming off of this cruise ship. Okay, so the reproduction number, also known as the RO or the R naught, think of a reproduction number as the number of cases caused by an infected person during this infectious period. So think spread. It was at 2.12 before the control measures were enforced, and it decreased to 0.96% after the measures were implemented. Once that reproduction number gets below 1, the outbreak starts to go away or die out. So the public health measures took it from 2.12 to 0.96. That means that it was spreading as a little outbreak to dying down or going away. So the public health measures worked. That is great. That's another thing that I kind of like all I need to know, right? This is great stuff to hear if you are looking at this as an epidemiologist, which if you are listening to Transmissible, this podcast is, we put on our epidemiologist hats. You are looking at this like an epi and you're seeing those and you're going, oh great, I don't need to worry if I'm seeing something that is super inflammatory online. I can probably consider that to be clickbait unless things have changed, right? So let's compare this a little bit to COVID. One of the big issues with COVID was asymptomatic spread. People were spreading SARS-CoV-2, which is the virus that causes COVID-19, before they knew they had it. So this is what really fuels an outbreak. You're not sick enough to where people are fully staying home, or if it's being spread asymptomatically. With hantaviruses, researchers think that the spread is in that early illness phase when symptoms have already shown. So you already know you're sick, you're more apt to stay home. And once the symptoms set in, it goes pretty quickly and people get very, very sick. If, like we saw with the other little outbreak, they did go to like a concert in that early illness phase. But when an illness progresses quickly, it also curtails spread, because it's like if you are laying in a hospital bed, if you're laying in the ICU and, you're kind of on death's door, you're not going to work. You're not taking a train to go to work and then going to get drinks after work and then going to a concert. You may do that with asymptomatic COVID, right? You may even do that with symptomatic COVID. If you had, a more mild illness, you might do that with flu. You might power through. And that is when stuff really, really starts spreading. Measles, we see, measles spread very rapidly. Like we'll get I live in Denver. The Denver airport is so busy. So, it'll pop on the news, like someone went through the Denver airport with measles. And, that's just really outbreak fuel, right? So hantavirus is a little bit different. It spreads once the illness has started. But now let's get in the weeds, because this is transmissible. Sorry, I'm like really talking with my hands here. It's an exciting topic for me. So this is still being researched, right? And the virus has been found, and I'm linking these studies, in body fluids before symptoms have occurred. But current research and epi findings do suggest that it starts spreading after the symptoms have started. So just to tie a knot on that block of information about transmission, just kind of bullet point why I am not afraid that this is the next COVID. Bullet points: the reproduction number, also known as the RO or the R naught, is low when it does spread human to human, specifically the Andes virus. Once public health measures are implemented, the reproduction number goes below 1. In this study that they did, that means the outbreak dies. That's probably why you've never heard about it. Or if you've had, it's like, oh yeah, hantavirus, like it's not one of these big, crazy outbreaks we've heard about, because public health measures do work. When it does spread human to human, it is from prolonged, very close contact, and even people who have very long, sorry, I'm clapping into the microphone, even people who have very long, prolonged contact, it is not even 100% that they are going to get sick. It's at 17.6%. In household contacts, it was 1.2% risk of getting sick. That's crazy, and that was in a real world outbreak spread situation. That's very comforting to me. Also, this is so different than COVID. COVID, like we said, one of the big issues was that it was spreading asymptomatically. Hantavirus, from what we can tell, the human-to-human transmission of the Andes virus, of the hantaviruses, it spreads once symptoms have already started. That's huge for an outbreak. That is very, very comforting. So this is so different than COVID. And it's a very serious illness. The case fatality rate on this is very high if it's coming from the Americas, which is what we're talking about with this cruise ship. But the spread, it just looks so different than COVID. And I think that should be very comforting to my listeners and the people who are worried about this. But let's talk about symptoms. Let's keep going through hantavirus. So in humans, symptoms usually begin between 1 and 8 weeks after exposure, depending on the type of virus, and typically include fever, headache, muscle aches, gastrointestinal symptoms such as abdominal pain, nausea, or vomiting. In the HCPS, that's the lung and heart ones, the disease may progress rapidly to cough, shortness of breath, accumulation of fluids in the lungs, and shock. In the HFRS, this is the kidney one that comes from Asia and Europe, later stages may include low blood pressure, bleeding disorders, and kidney failure. Remember, that one has a much lower case fatality rate. Samples collected from patients are a biohazard risk. This is for my lab girlies and guys. Laboratory testing on non-inactivated samples should be conducted under maximum biological containment conditions. All non-inactivated biological specimens should be packed using the triple packing system when transported nationally and internationally. During outbreaks or when cases are suspected, early identification and isolation of cases, monitoring of close contacts, and application of standard infection prevention measures are important to limit further spread. We saw that, like we were talking about in the last outbreak in Argentina. CDC's director very recently made an announcement to the American public and said, hantavirus are not spread by people without symptoms. Transmission requires close contact, and the risk to the American public is very low. CDC has the world's leading experts on hantavirus and is lending its technical expertise when coordinating with interagency partners, state health offices, and international authorities on response and reparation planning. So it seemed like the people, it's kind of like if you know, you know, and if you know, you're not worried about hantavirus, but you think it's very interesting. That's where I am sitting in. I would be very concerned if I was on the cruise ship. My prayers go out to the cruise ship people. That really sucks. That sounds like, as they're describing this cruise, I'm like, oh my gosh, this is bougie. This is nice. I would love to cruise around Antarctica. That sounds insane in a good way. And so I feel for them that this was just this, like, it sounds like a trip of a lifetime that is just being marked by this very dangerous, scary illness. And so my heart goes out to them. And then in the next vein, but the general public doesn't need to worry unless things change. As we know, science changes. And when you mix, science that is rapidly being discovered as more research now, the whole world is looking at hantavirus right now. So as research progresses, I'm sure there will be a lot of scientists and public health professionals looking at these cases, and we will learn more about the Andes virus from this. So as that happens, and if you mix science and human nature, sometimes things can get a little wily, but I am not concerned. What will I be doing over the next few weeks? I'm going to be watching how the different nations, WHO, CDC, and the like handle this. I think that's very interesting. I know as of right now, this is May 9th, Saturday morning, I'm recording this. I know right now they're transporting the Americans to a quarantine center in Nebraska. We have these centers all over the world where you have subject matter experts, you have special pathogens units, and they know what to do. Shout out Spokane, shout out Emory, shout out Nebraska. This is, we have the lab capacity, the hospital capacity, the expertise capacity. America is very prepared for something like this. Now, you might roll your eyes and say, Jessica, COVID was crazy. Like, that went all over the world. That's true. But this is a little bit smaller, and it'll be fine. That's my take home. But it'll be interesting to see how this unfolds. My family and I, we're still going on planes. We have plans to go on a plane within the next month. And yeah, if anything does change, if new crazy research comes out or a mutation or, something like that, I will jump on here and do an update, because my promise is that if you are a transmissible listener, you are in the loop, you are in the know, and this is just like a crazy topic. This is just going crazy viral. So I wanted to jump on here and just give some facts and just say why I think this is very interesting, but also why I am not concerned about the Andes virus spreading to the general public. So I think that's about it. Thank you guys for listening. I just really appreciate the support. And, my last episode was Nipah virus. That got some traction in some of my international communities. And so that's always really fun for me. And so just shout out to those countries that are tuning in and getting on the charts over there. And I just love this podcast and I love doing this. So yeah, if you have any questions, any concerns, if I got something right, if I got something wrong, shoot me an email at transmissiblepodcast@gmail.com. I'm also transmissiblepod on TikTok. I'm mainly using TikTok right now. I would say that's my main social media platform. So come say hi. Thank you for listening. And yeah, I'll see you guys next time. Bye.